Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Ketoconazole. Some brand names for this medication would be Nizoral or Extina. Now, before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would give this medication to a patient, followed by contraindications or reasons we would not be able to give ketoconazole to a patient. We'll then discuss some examples of dosing, and then finish it off with side effects with percentages. I put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So ketoconazole causes inhibition of 14A demethylase, which blocks the formation of ergosterol and leads to the buildup of toxic methylated 14A sterols and depletes ergosterol in the cell membrane. This results in weakening of its structure and function. In terms of indications or reasons we would give this medication to a patient, we may see it used in the treatment of candidiasis of the skin, as well as in the treatment of dandruff. Patients with pityriasis versicolor may use this medication, as well as patients with seborrheic dermatitis. This medication, ketoconazole, can also treat tinea corpus, cruris, and pedis. And it's also used for some other indications as well, but I just listed a couple examples here. With respect to contraindications or reasons we would not give this medication to a patient, while patients who have a hypersensitivity to ketoconazole or any other components of the formulation would not use this medication, if the medication is used orally, it would be avoided in patients who are using CYP3A4 metabolized HMG-CoA reductase inhibitors, such as simvastatin, which is a cholesterol medication. As well, when taken orally, we would avoid this medication in patients who have acute or chronic liver disease. Now for some examples of dosing with ketoconazole. So in the treatment of candidiasis of the skin, we may apply a 2% cream topically once daily for 2 weeks. When this medication is used for dandruff, you may apply the shampoo, which is 1%, topically to wet hair, lather, rinse thoroughly, and repeat. The patient would use this every 3 to 4 days for up to 8 weeks, and then just as needed for dandruff control. For seborrheic dermatitis, if they're using the cream as a dosage form, they may apply topically to the affected area twice daily for 4 weeks or until clinical clearing has occurred. As with all medications, there are some side effects or adverse reactions that patients may experience while using ketoconazole, so we'll go over some of those here now. If a patient was using a topical formulation, they may experience a burning sensation 4% of the time, or pruritus, as well as also known as itchiness, less than 1% of the time. For the oral formulation, a patient may experience nausea or vomiting. Alright everybody, that's all we're going to talk about today with ketoconazole. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.